Thank you to the American Heart Association for being in partnership with this conversation. We appreciate the collaboration, and I look forward to what we're going to discuss today. So before we get started, I'd like to take a moment for our speakers to introduce themselves, and then the moderators will give a brief introduction, and we'll dive right into it.
Okay, well, I'll go first. My name is Jarretta Utley. I'm a this year 20-year survivor of a heart attack, and I am a heart health advocate. I just believe that we as African Americans and women should speak up for ourselves when it comes to our health in all aspects of our health.
Thank you.
Hello, everybody. My name is Jovi. I'm a board certified family nurse practitioner here at Matthew Walker Comprehensive Health Center. My background does include many years of being a cardiac nurse prior to getting my nurse practitioner degrees. So I have a lot of experience with heart disease patients and many years of knowledge.
Thank you.
Hello, my name is Edwin Fagans Jr., and I am a CPR instructor and owner of Live Medical. I am a practitioner also. Not sorry, I said practitioner. I'm a provider. Also, can I just do that over or no?
You're fine. You can.
Okay. All right. I'll just start over. Hello, my name is Edwin Fagans Jr. I am a CPR instructor and owner of Live Medical. I'm also a provider as a first responder here in Nashville, Tennessee.
Thank you for joining us.
Should I go next?
Sure, Candace, that's fine.
So I'm Candace Jones, Vice President of Community Impact here at the American Heart Association in Middle Tennessee. Thank you.
I'm Philip Morris, and I'm a public health practitioner with Matthew Walker. So glad to have you all here.
Thank you. And I am Shanika Kidd. I also am a public health professional, and I work on the second floor, the administrative floor at Matthew Walker Comprehensive Health Center. All right, so I am going to open up the floor for an icebreaker question. And the question is, when you hear the phrase heart health, what comes to mind? And anyone can answer. It isn't in any order.
I think what comes to mind is just keeping your heart strong and doing things to keep your heart strong so that it can do its job every day.
Thank you.
My thoughts are to all your parts functioning and us feeding and eating and exercising things so we can continue to have a strong, healthy heart.
I like that. Thank you.
When I hear the phrase heart health, I think about heart health from a preparedness standpoint and a prevention standpoint. As a first responder and a CPR instructor, I see firsthand how cardiovascular diseases affect families, and usually when they see me, it's without warning. So I think about heart health from a response standpoint.
Thank you for that. So I'm going to start with some questions, and I wanted to start with this. For viewers who may be hearing terms often but aren't sure what they mean, can you explain what cardiovascular disease is and how it is typically diagnosed?
So I'd say it's any problem with either your heart or the blood vessels in the body, and that includes blood pressure issues, heart attacks, strokes, aneurysms, and then even heart failure as well.
Okay, thank you, Jovi. And I know we're going to hear from Ms. Jarretta a little later about her journey overcoming or surviving her heart attack. But I also wanted to ask you, Jovi, are there early warning signs that people should never ignore as it relates to their heart?
Oh, yes. There are several warning signs that are often subtle, so people can miss it if, they're just not paying attention or they brush it off. So anytime you have even like a little bit of chest pressure or chest tightness, sometimes it's not that textbook pain.
Mhm.
It could just be a little bit of pressure. Um, Anytime you feel abnormally fatigued, like this is out of your norm, and for whatever reason, you just don't have the energy to do things that you used to be able to do, you're
Mhm.
out of breath for whatever reason. Now you can't even walk up the stairs like you used to be able to do, or you can't lie flat in bed without getting out of breath. Those are things to be mindful of. And then, like, you notice some swelling in your legs
Mhm.
along with that, especially if it's like both legs. That's something to get looked at. And if you notice that, or if a partner tells you, hey, you snore a lot in your sleep, and I've noticed you're not breathing sometimes during your sleep,
Mhm.
you might want to get that checked out. And blood pressure. If your blood pressure is elevated and you know you've got family history of high blood pressure, I would also get that checked out as well.
Okay, thank you for that response. We know that we should, of course, be interactive with our health, and so I really wanted to ask that because we know that by just regular checking in with your provider, that a lot of things can be caught early, and so I appreciate your response. And I want to move down and speak with Ms. Jarretta because you did experience a heart attack. I believe you mentioned earlier about 20 years ago.
Yes, yes, yes. I
Okay.
was oh, yes. So August 16th,
Mhm.
2006. It was in the evening time. At that time, I was only 35 years old, and I just had Jillian and my daughter. And that night, I was at home, and had just been sweating the entire evening. And I'm thinking it's just because I've been messing with her, moving around. I was just sweating the entire evening, not thinking, of course, anything else was going on with me. So I got up, told my mom, and she brought me some soda. She said, maybe you have indigestion. I was like, no, it's not indigestion.
Mhm.
So I knew at that point something was wrong because I didn't yet feel any pressure in my chest. I just knew something was wrong. And so I started packing the baby's bag to go to the hospital. And then I found this out later once I was bad, and my mom had told me why she called 911 because I said, why did you know? She said, because of how you looked at that
Ooh.
time. So they came, they talked to me, what's going on. I told them, got in the ambulance, went to the hospital. And then on the way to the hospital, the paramedic did, I guess it would be the EKG, and he said it printed out mild MI. So I was having a mild
Mhm.
heart attack. And I had a 100% blocked coronary artery for my heart attack. And from two things that when I tell my story like this, that I was not taking my blood pressure medication at the time, and I had blood pressure issues since I was in my 20s. I was
Okay.
all through my pregnancy. I was taking the medicine, but I wasn't working, and I just did not take the medicine during that time. And then from like I don't have diabetes, didn't smoke,
Mhm.
none of those factors. But in the earlier years of my college life, I'm just eating unhealthy. I'm eating, burgers and fries and chips, and just my arteries was just like, enough is enough. Then I learned that I live with arteriosclerosis also, so make my body making more plaque than it needs. So yeah, so that's kind of the short form of my story. And I stayed in the hospital. Oh, I had an arteriogram, that I got cleaned out, didn't have to get any stents, thankfully. So and I just, every day since then, it's just um, a journey of living a heart healthy life. And what I leave for people too is just eat more baked, less fried, and just patient everything that goes into your mouth.
And I wanted
Oh,
to chime in on that, Jaretta, because one of the things that we hear so much, especially because American Heart Association, we have our Go Red for Women campaign, is that you experience a symptom that is not a traditional symptom of a
Yes.
heart attack.
Yeah.
And with our Go Red for Women campaign, I've had people ask, like, well, men have heart attacks too. Yes, but heart attacks in research has always been considered an old man's disease. So it was not studied and has not been, even to this day, studied enough in women. And so women experience different symptoms when it comes to a heart attack. And so I think that's so important to highlight that you were just sweating profusely, or as women, we like to say glistening. You were
Yeah.
Yes.
glistening profusely. And on a normal day, that's not something that as a woman, especially you have a young child, you're chasing her around, trying to
Yeah.
keep up with her. And so I'm so glad that you had your mom there, someone to advocate and say, nah, something isn't right. Because far too often, too many women die because either they're so concerned about everyone else that they don't speak up for themselves, but then other people don't recognize the signs either. And so they go on and on until it's too late. So I'm so happy that you had your mom there to advocate and speak up for her baby while you were looking
Yeah.
after your baby. So
Exactly.
absolutely, absolutely.
Thank you.
And
Yeah.
Jovi, can you speak to the difference between symptoms in men and women when it comes to that? Because again, we know the signs are different, but just kind of elaborate on that more for us.
Definitely. So, just to kind of piggyback off of what you were saying, Candace, women tend to have more subtle symptoms that are not classic textbook heart attack. So, the sweating that Miss Jarretta was having, my mother, instead of chest pain, she would have jaw pain, and it was just right and at the jaw, nowhere else. It didn't radiate anywhere else. It was just constant jaw pain. Um, Nausea and vomiting is another common one with women. And then sometimes just back pain. So I think textbook for men, it was always that kind of there's an elephant sitting on your chest type
Yes.
pain that would radiate down the left arm. That's what we always learned in school. And that is more so typical with a lot of men. But women and those that are diabetic as well, they won't have those classic symptoms a lot of times. And it'll just be like, oh, a little nausea, a little back pain, maybe jaw pain, things like that. And so it is very important, especially if you know that you have a history of heart disease or somebody else in the family has had a heart attack. As soon as you have those symptoms, there is no shame in going to your doctor and asking to get checked out. No doctor is going to think that you're crazy because, we want to help you, and it's good that you want to advocate for yourself, and that's what we're here for.
Nice. And in speaking with on some of these signs and symptoms, Edwin, we know that in cardiac emergencies, basic life support can be the difference between life and death. So, could you explain what BLS is, and also why it's important for everyday people to learn it?
Philip, thank you for that. Um, BLS stands for Basic Life Support. I'm often asked, what's the difference between CPR and BLS? CPR, of course, is cardiopulmonary resuscitation. That is in itself, it's a life-saving technique that involves chest compressions and sometimes can involve chest compressions, and it sometimes use rescue breaths to maintain circulation and oxygenation um, during a cardiac arrest. BLS, on the other hand, is more so a healthcare provider level certification. It includes CPR skills, but it also gives insight into other areas such as AED usage. Clinicians would need to know more so team dynamics, airway management, and how to care for different types of patients, so adults, children, and infants. The BLS certification, of course, is taken through a class, and it's typically designed more so for healthcare professionals. And you can receive that certification through organizations like the American Heart Association. I believe the second part of your question was why is it important for everyone to learn? I'm a big stat guy, so each year around 350,000 out of hospital cardiac arrests happen in the United States of America. And when you think about that, that's a lot of people. Majority of these out of hospital cardiac arrests occur in the home. So you have about a 70, percent to 74% chance of all of the out of hospital cardiac arrests are happening in our own homes.
Mm.
And so that can seem like a very intimidating statistic. But if CPR is performed immediately, we can double, almost triple the chance of survival in out of hospital arrest.
You actually, I would say, answered my next question. I was going to say, how quickly should someone act if they're feeling that they're having any types of signs and symptoms that may be a heart attack or some cardiac event?
Um, we don't have a specific number for you. I think the best answer for that is immediately. It kind of goes back to what Jovi stated earlier. When you feel the signs and symptoms and things are literally irregular, things that we don't feel normally, there's no problem with calling 911 or your local emergency number to go ahead and start what we consider our chain of survival. We can only think about what we're going through in a certain context while we're at home. We need advanced, imagery. We need a higher level of care to be able to diagnose what exactly. We would rather it be nothing and you went anyway, rather than it be something and you didn't go at all. I think the key thing is to recognize the warning signs. And as we stated earlier, the warning signs are different between men and women. One that I didn't hear anyone say earlier was actually, I guess it could be covered in nausea, but heartburn still presents in men and women. And it's a very important thing because we brush heartburn off to buffalo wings or acidic
Yeah.
foods when, sometimes the heartburn, we're having heartburn and we haven't had any of those. So definitely something to pay attention to. And then also, I know that especially I can speak for myself, sometimes we try to see if things or symptoms can go away. And when we do that, it's when we put ourselves in the biggest, in the most danger. So call 911 right away. So immediately.
And
Thank you.
Edwin, I'm going to piggyback on what you said about, getting 911 immediately. And I'm coming at you, Miss Jarretta, as
Okay.
far as we know, during your when you recognize that something was off was the sweating. But prior to that, thinking back on that, maybe a few days beforehand or even a week before, was there anything that you noticed that like Edwin said, just brushed it off, like, oh, maybe I had, too many hot wings or something. But was there anything else that you experienced that you're like, that may have actually been my initial sign that something was off?
Thinking back about that, I can really say no. I don't recall that I was having any other issues during that week. It was just a regular take care of her week, being mommy, things that I can like remember. Possibly, maybe because we lived in an apartment and we had to walk up steps, but carrying her. So of course I'm having her and everything else. So I'm not thinking I'm out of breath for that reason. But honestly, no, that I can recall back. I do not remember or recall any other warning signs than to when it hit me that
Okay.
night.
Gotcha. And since we're on this topic of, sudden cardiac arrest and heart attacks, Jovi, can you talk about the difference between the two? Because so many people think that they're one and the same, and they are, exclusive. They have their own, their separate definitions. And I hear even some volunteers, or when we're out doing hands-only CPR demonstrations in the community, they're like, oh, I know someone who, went to study, had a heart attack. And it's like, wait a minute, hold on, that don't sound like a heart attack. That's actually like they were down for the count for a little bit. So can you explain the difference between those two?
Yes, definitely. So I think in the simplest way to put it, like cardiac arrest is basically you have flatlined. At that point, there is no electrical current going through the heart like it's supposed to, um, and that is how I like to think about cardiac arrest. With a heart attack, that is more so coming from a blockage of an artery where that blockage just stopped the blood flow, and the heart was not able to pump like it's supposed to, because the heart has many jobs, and one is it's supposed to pump blood, and then the other one, it's kind of like it's our pacemaker of our body, and it has these electrical currents, and so that's how I like to think about those two. The main differences is cardiac arrest, the electricity got turned off, that's flatline, the heart has stopped completely. Heart attack is more so there was a lack of blood flow due to a blood clot that stopped the heart from being able to pump like it should.
Okay. Thank you for that. I can admit that I have grouped those two things together in my just understanding of what they are. So I appreciate the breakdown of the difference between those. And since we're talking talking in about around this, I wanted to ask about myths. So to improve the quality of health information that we consume, are there any myths about heart disease that you wish more people understood?
I think the biggest one I hear all the time is um, I don't need to take medicine because I feel fine. So what was the point of taking medicine? And people are running around with their blood pressures like 200s over 100s or whatever, and they fortunately don't feel anything. And so they don't feel the need to take their medicine. And that's the thing. Hypertension or high blood pressure, it's known as the silent killer, right?
Yes.
And so you may not have symptoms yet, but by the time you do, a lot of times it's already too late at that point. And so that's why it's so important to take your medications when your doctor tells you you really need medications for this. Same thing with cholesterol levels. When your cholesterol is high, you don't feel anything. There are no symptoms really when you have elevated cholesterol until you have a heart attack or a stroke. But then by that point, it's already too late. And so another reason why we always want patients to take their cholesterol medications and eat a low fat, healthy diet, things like that. So that's like the biggest myth that I hear all the time. And then the other one, I guess, is like, oh, I'm too young to have a heart attack. That is
Okay.
not true, because there are people in their 20s that, they're completely healthy and then all of a sudden have a heart attack. And so heart attacks don't discriminate against age. It doesn't matter how young or old you are.
Thank you, Jovi. And this is for anyone who wants to take a stab at it. We know that heart disease continues to be one of the leading causes of death in the United States. So what are some everyday habits or lifestyle changes that you can tell our viewers that they could start right away to protect their heart?
I like that question. I say watch your mouth. And I've had people ask this question before, and I automatically start with the mouth is the oral passageway to the rest of the body. And we should continue to increase the awareness regarding our oral health. Um, we can start by the little things, start scheduling and attending our dental appointments. That's the big deal. And when we think about our mouth, chronic gum inflammation and the oral pathogens play a big role in cardiac health just because they contribute to systemic inflammation and elevated blood pressure. And so when we think about, I think we put the mouth on the back burner, but what we ingest deals with, creates a lot of the issues that we have internally.
It's good.
And I was going to kind of piggyback on that
Sure.
too, as far as the mouth being, that is how we're contributing to, the high rates of cholesterol. But the behavior that I wanted to mention was tobacco and vaping. We've definitely seen a rise in that especially with our youth. And then we know in communities of color that, menthol cigarettes have, definitely been pushed and marketed in our communities. And so doing our best to reduce and then eventually eliminating tobacco usage, because it doesn't just affect our lungs, it affects our heart, as well as once you start affecting those, it's just like a trifecta of then, now you're dealing with cardio, kidney, metabolic diseases and things of that nature. So yeah.
Okay. Well, we're
I
going to
wanted
move
to
right. Oh, go
I
ahead.
wanted just to add,
Yes, please.
just a simple everyday habit, lifestyle change for us who are like busy with like get up, morning, school, kid, night classes, do something different. For me, just thinking about just simple walking, going for a walk, a short walk, doesn't take a lot of, of time. And then as the more you walk, the better your habits become. So that's very helpful for me saying, oh, I don't have time, but really I have time to sit and watch television. I have time to maybe go for a walk. So that's very helpful for me. And then another thing is just what a person, I was at some type of lecture and she said to schedule your exercise on your phone because we schedule everything else. So I just, I put, not that I do it every time, but I'll put walk like 5:30 to 6:30 on certain days of the week. It just makes you see it, makes you like, oh, I didn't do it today, but I'm striving to try to do it the next day or the next time I have it scheduled. So I just feel just a smile. And then also getting up a little earlier to maybe exercise, maybe dance, maybe do some Zumba, just some kind of workout. That also is a little lifestyle change. You can do a small amount at a time. You don't have to be big 45 minutes, but just do a little at a time. And that'll seem to kind of get you in a good habit. I just believe in making habits.
I truly believe that small changes do lead to big impact. And so incorporating those reminders and small habits definitely can help lead to a healthier lifestyle. And so I appreciate you for sharing that, especially because the next question was going to be, what does prevention realistically look like for someone with a busy schedule or limited resources? And so I appreciate that answer. And Jovi, on the patient-facing side, I'm sure you encounter patients who maybe miss their appointments. And so could you speak a little bit to about what does prevention look like for someone that is potentially super busy or has limited resources?
Oh, yeah, definitely. So, with the kind of patient population that we see at our clinic, um, it's expensive. Healthcare is expensive. Food is expensive. Medications are expensive. Um, some people just can't get to their appointments due to lack of transportation. And so it's a battle. It's a constant battle every day. But things that you can do, just like everybody else was saying, just simple things. It's even just small things, walking during your lunch breaks at work, or even taking steps around the house when you go to the grocery store. park a little farther away from the door. That way you get your steps in that way while you're going to the store. If you are in the grocery store and you're around the pharmacy area, they have a blood pressure machine there. Check your blood pressure. Keep track of your blood pressure that way. Drinking water rather than going for the sodas and sweet drinks. Just drink some water. For like, set a timer on your phone or something to remind you to drink more water. And then of like, in America, our salt intake is terrible as a country. And so just being mindful of like how much salt you're actually intaking
That's
in your
good.
diet too.
That's good. Thank you. Any other realistic prevention tips that we want to share?
Yeah, I'd like to kind of piggyback on what Jovi said as far as healthcare being expensive.
Mhm.
And there's a quote that I saw not too long ago that said, "You're either going to make the change now or you're going to pay for it later." And so often we say, if there's a dress or some shoes that we want, oh, I'm not going to pay for that. It costs too much. We have to have that same mindset when it comes to our health too.
Mhm.
Like, let me take care of myself now so I don't have to worry about being on 4, 5, 6, 7, 8, 9, 10 different medications later
Yeah.
on in life because I know it's going to be expensive. I know that if I put myself in a position where I have to be in the hospital, that bill is going to be too high for me to want to have to take care of and worry about trying to pay off. So focusing on doing the things like Jarretta said, being physically active. Maybe it's a walk. Maybe you like dancing. I personally, a couple of years ago, started doing salsa dancing. And let me tell you,
Okay.
you will break a sweat just doing a little two-step. So it doesn't have to be anything, like, oh, yeah, I think people, when we think of the word exercise, we think about it being strenuous. We think about, oh, it's going to hurt, things of that nature. But there's so many different things that you can do to be physically active and exercise. Like I said, dancing, you have Zumba, jazzercise. If you like to swim, if there's so many different things that you can do. You also burn a lot of calories doing CPR as well. So it's one of those things too where it's just like you either gonna burn the calories having fun or you're gonna burn the calories being rushed in an EMS to a hospital. So it's one or the other. And so I
Okay.
would hope that people choose the former and being physically active. And it's something that I have to tell myself too, because I'm on a statin for having high cholesterol.
Okay.
Both my parents have high cholesterol. My mother is pre-diabetic and my father has diabetes. My father has high cholesterol so bad that he has the pockets of cholesterol that you can see on his eyelids. It's so high.
Okay.
And so for me, it's something that I absolutely have to be cautious of, and make sure that I'm taking my meds every evening like I should be, because I don't want to end up having a heart attack. And knowing that I'm at risk for that. So it's something that I have to pay attention to now so I don't have to pay for it later.
I like that. And I just wanted to quickly say that Matthew Walker, Mr. Jeff Bagwell, he is the EMS professional that does Matthew Walker's CPR trainings. And I thought, okay, I'm going to do CPR. This gets me a few hours away from work. But then I got to pumping and doing it on beat. And so
Yeah.
you're right, you do burn
Yes.
the
Our thing here is push hard and fast. And so, if you're doing it properly, you're pressing 100 to 120 beats per minute. So it is truly a workout. It's not going to feel good to the person should they survive after having CPR, because you're going to be hurt, may have a broken, sternum or some ribs, but you can survive that. We have people, when we're doing the hands-only CPR demonstrations, that ask, well, what if I hurt them? Honey, they're dead. Their heart isn't beating. They don't feel that. They may feel it, hopefully they wake up at the end,
Yeah.
but we're not focused on if they're hurting or not. You are literally functioning as their heart, keeping keeping that blood flow going. And so it's definitely very strenuous doing CPR. So that's why I said, you're either gonna lose the calories on the front end, having fun, or you're gonna help somebody else lose calories because they're doing CPR on you.
That's right. That's right.
Nice. So I would like to move into how we can support loved ones. So, um, for anyone, for families and friends watching, what are meaningful ways to support a loved one living with heart disease and help improve their quality of life?
I'll chime in first with that answer. I would say support and just a basic how are you feeling today? Do you need anything? And maybe for younger people, maybe someone has a child. Do you need somebody to watch your child while you go to the doctor? Do you need money for your medications? Oh, I know of a program you make it help get you your medications for cheaper. Just things like that, just to help show that you like care and you may not be able to understand what we live with, because for me, I think about it. I think about that I live with cardiovascular disease every day,
Mhm.
because I need to make good choices, because my plan is to live many more years. I need to see Jillian graduate from college, to get married, to adopt a child, all those things. So for me, it's just the question of how you feeling, what do you need? Do you need anything? So that's my take on that.
I think I think that's spot on.
Me too.
When I think about, families and friends, and then I also think about myself, and I try and flip the, turn, see myself on the other end of the table and say, what would I need? And I think the biggest
Mhm.
thing is encouraging healthy lifestyle choices and then actively participating in them with your family member. I live by the quote, we go further together. When I think the mental aspect of lifestyle changes is that you're doing it alone. Oftentimes we hear people say, well, I'm doing this for somebody else. When in fact, really, we're doing it for ourselves. And you can't give 100% of yourself to someone else if you're not at 100%, right?
True.
And so, being able to incorporate healthy lifestyle choices, we spoke about earlier the little things we can do. I'm a North Nashville resident. I'm a native Nashvilleian, and traditionally North Nashville has been a food desert. And so, yes, eating healthy is expensive, right? It's leaning on community resources that are available, to offer produce, fresh produce, or healthier eating food options. And then, how do you make that something that everyone wants to do?
Mhm.
Farmers markets and community gardens and things of that nature. Those are things that we can do together, that encourage healthy lifestyles.
Nice. So also about the caregivers. Caregivers oftentimes are caregiving and they don't really focus on themselves or their own health or anything like that. Could anyone speak on the importance of, and also ways of how caregivers can also be sure to take care of themselves?
Philip, I'll jump right back into that. Continuing what I did, what I previously stated about giving 100% of yourself to others. Oftentimes, caregivers neglect their own health. I think it's important for us to acknowledge limitations, and then as a caregiver, to also give yourself grace. When you give yourself grace, you're also allowing a space for rest, for recuperation, and we're seeing higher or we're seeing more cardiac related incidents that have come from stress and come from the fact that we're not giving ourselves our 7 to 9 hours of rest. And so when our bodies are continuously running and we're going to continuously go and go and go, we get to a point where we're tired, and that's where the body becomes weak. So I think to summarize that, giving yourself grace, allowing yourself rest and realizing, hey, I'm not at 100%. I might not be the best, that I might not be able to give the best care that I'm able to give if I don't rest. Your body will talk to you and you'll shut down. And at that point, you don't have control.
And Edwin, I wanted to chime in there also to mention that it's important to have a village. I know we always say it when it comes to children, it takes a village to raise a child. But as you know, I personally feel like even in adulthood, you still need a village. And especially when you're caring for loved ones after a heart attack, post stroke. There are a few groups here in Middle Tennessee that actually have stroke support services and groups. Skyline Medical Center here in Nashville. There's also Neurotherapy Nashville's seriously awesome caregiver support group that's in Brentwood. And then Hendersonville Medical Center also has a stroke support group. And I think there's a mixture of virtual and in-person options. So just putting that out there because sometimes it helps to have individuals who are going through the same thing or have experienced it, you know, to have that support group that you can go and talk to. And a lot of those support groups will also have other services available for either the caregiver or to benefit the person that's being cared for.
Thank you, Candace. I like that. And I just wanted to chime in from Edwin's comments as well, because when I think about caregivers, I think about them being the drivers of a car or a vehicle. And so I do think it's very important that that caregivers prioritize their health while they're also caring for their loved ones, because if the person driving the car stops, then the entire car stops. And so that means that the caregiver would not be at their best self to be able to provide the level of care and love that they do. And so back to your point, Candace, of take care of it now or you might have to deal with the aftermath, you know, at a later time. And so I think about that, especially because a few of the women in my family have been caregivers or are caregivers, and I see them on the go all the time. And I rarely see them, you know, just check in and say, oh, well, hey, can I call you back? I'm at the doctor. Or, hey, I'm planning to go to the doctor. And so when I think about my family and me, of course, wanting them to live long, I do think that it's important. I think that I have an action item leaving here to just check in with my loved ones to make sure as they're checking in on our loved ones that they also are prioritizing themselves. And so that's great. Thank you. So we're getting close to the end. Before we officially close, I wanted to ask our guests or I wanted to ask the guests to respond to this question. What is one message you want every viewer to walk away with today as it relates to heart health?
I'll go first with that. So for me, in general, for me, I'll say, just speaking for my own self, that living with heart disease doesn't define me, is not who I am. It's just what I live with. So I just continue to live my life every day in the way that you never know what's happening next. So for me, just to tell everybody to just live your life full to the fullest that you possibly can, because you just do not know from one day to the next day what's going to happen. And whatever you are living with, it does not, again, define you. It really just can make you stronger and better.
Thank you.
I would say just small, steady changes that you can do can protect your heart. And that consistency is key, and it's more important than perfection. So just whatever you can do, even if it's just a little bit of walking, a little drinking more water, even just the small things makes a huge difference.
Thank you, Jovi.
I think, of course, I would have to say CPR saves lives. Recognize the signs, call 911 and be ready to respond if you're ever needed.
Okay, I appreciate that. And so I'm going to give our guests just a few minutes to catch their breath because I'm going to ask Candace and Philip to share any heart health resources from Matthew Walker and American Heart Association that our viewers can just be aware of, or if there's opportunities to volunteer. We would love to hear that at this time.
Um,
Absolutely. Philip, did you want to go first?
oh, you go ahead, ladies first.
Okay. Thank you. So here in Middle Tennessee, we have set up several blood pressure check stations. One of them being at Hadley Park Community Center, where you literally can go and use upper arm blood pressure cuff to check your numbers. There's also resources such as blood pressure logs and things like that that are also there. But another, I want to say, a hidden treasure that a lot of people probably don't know about is that you can go check out a blood pressure monitor at the Nashville Public Library System. You can check it out just like you would check out a book, and check it out, keep it, please return it. Um, don't do it like those books, that you have that you forgot about. Please return it. But you can check out a upper arm blood pressure monitor, like I said, just like you would check out a book to keep track of your numbers. And we've done that because we know that blood pressure monitors can be expensive for, someone who is low income, buying a blood pressure monitor could be do I buy this or do I put gas in the car? And so to alleviate that stress, we have those monitors available that you literally could check out at your local library. That service is available at all 22 locations, I believe. So that is an option as well. We have several clinics that we've partnered with, Matthew Walker being one of them, where patients also have accessibility to monitors. And so we're happy to support those local clinics who don't have an SMBP loaner program available. We're happy to set that up with our local clinics here in Middle Tennessee as well. So, and if anyone wants to get in contact with AHA, I'm happy to provide my email. It's Candace, CANDACE .Jones, JONES @heart.org.
Thank you, Candace. Well, at Matthew Walker Comprehensive Health Center, um, we have multiple providers who specialize in family care that will take care of our patients who have hypertension or any other chronic condition. But we also have a blood pressure monitor in in our lobby of our Nashville location, off 14th and Jefferson, where anyone can come in and just check their blood pressure. As Candace already stated, we also have monitors that patients can go home with from their visits. And we have a pilot hypertension program. This program, it it is for patients within our North Nashville area, but they have access to other services, wraparound services that they may need, such as food project, for healthy meals from the food project, activities from Metro Parks, um, and some other services. And so we also have three locations. So we have our Nashville location, Smyrna, and Clarksville. So we service those three areas. And we're always happy and ready to see new faces that are looking for a healthcare home and also looking to just maintain good health.
I put myself on mute. Thank you both for sharing some of those resources and opportunities. I am going to close us out, but before I do, excuse me, Edwin, Jarretta, Jovi, thank you all for coming with your expertise and having this conversation with us. We appreciate your voice and We look forward to connecting with you all past this heart-to-heart conversation. And I wanted to, of course, thank the viewers for joining. If something has resonated with you that we've discussed, please leave us a comment. And if you have any questions, if you leave us a comment, we will work behind the scenes to make sure that we're able to get you a response from one of our providers as soon as possible. And of course, we want you to prioritize your heart health. The heart is where everything flows from. And so we want to make sure that we are intentional about our heart health. So thank you all again. Thank you for joining. And until next time, we'll see you then.